Dr Philippa Whitford.
Much, Madam Deputy Speaker. I too welcome the Secretary of State's statement, and we support the use of powers to maintain isolation, as this is critical for the health safety of other people in the country. I would, however, also support that these must be transparent and proportionate. I also welcome that the 4 chief medical officers across the UK are working together on this. Now, the government is advising symptomatic returnees from the high-risk countries, but should it not be all people returning from the high-risk countries? Because we simply don't know what the prodromal part of the incubation period is, nor how infectious someone actually is before they have any symptoms at all. And I have to say, I was surprised to see the bus drivers who were driving those on their way to quarantine sitting in the front seat in shirt sleeves, beside someone in full hazmat gear. So that, to me, seemed to send out a rather strange message. It's also advised that only those from Hubei province should self-isolate, even if asymptomatic. But we see from the cases in France that this is spreading very quickly, and we already have 40,000 cases across 28 countries. And therefore, if anyone is flying and going through airports, there is the risk of spread, of simply being on an aeroplane with someone coming from China. I welcome the funding into vaccine research and the expansion to 12 test centres across the 4 nations. But what publicity campaign is planned to educate the public up front not to go to their GP and not to go to accident and emergency, where they will actually spread it to someone else? I understand the information is there on the Scottish Inform System or 111, but if someone isn't looking, maybe we need to be proactive about the message. And finally, the UK is no longer part of the European Centre for Disease Control, and while we're able to take part of the early warning and reporting system during transition, we're no longer part of the decision-making or central procurement of vaccines. So how much of that system is the UK still able to be part of at the moment during transition and in the long term? And does this perhaps raise up the agenda some of the areas of cooperation that need to be sought with the European Union agencies?
Hear, hear. Thank you very much, Madam Deputy Speaker. Well, I'm grateful for the broad support expressed by the Honourable Lady, and I'm also very grateful for the work of the devolved authorities in Scotland, in Wales, in Northern Ireland, and the work of the 4 CMOs across the UK who've worked very closely together on what is a public health emergency. To answer her specific questions, all of those returning from any of the named countries, which I reiterated in my statement, should, if they are symptomatic, should self-isolate. We're taking all measures that are deemed to be effective on the clinical advice, and as a clinician herself, I'm sure she will recognise the importance of following the epidemiological science wherever possible to make sure we take steps that are going to be effective and are proportionate to the scale of the challenge. She also asked about monitoring of those returning on flights. We have enhanced monitoring in place for all those returning, as I said. She also asked about a publicity campaign to get the message across that people, both in terms of what people can do, that is to say that people should wash their hands and follow the catch it, kill it, bin it tissue use campaign, but also the important message that the first thing you should do is call 111. And we have that. We do have a very significant publicity campaign, and I will double-check that is being coordinated with the devolved authorities, which I think it is, but I will double-check because that's very important. But overall, I would say that, and finally, I'll answer the point about the bus drivers. That was again a decision that was taken on clinical advice to promote the safety of the passengers and balance all of the considerations that needed to be taken into account.